At Brisbane North PHN, our vision is a community where good health is available to everyone. To help us achieve this, we support general practices in the region to deliver high-performing primary care. We do this through a range of quality improvement initiatives. This quality improvement microvideo forms part of a suite of educational videos to provide practice managers, reception staff and practice nurses with tips to implement quality improvement activities in general practice. Welcome to the Brisbane North PHN's Quality Improvement Microvideo series.
Welcome to this video on pandemic planning brought to you by Brisbane North PHN. We have all lived in a pandemic, or should I say, we are all still living in a pandemic. As we live through each month, from the lockdowns to the travel bans to the masks and working from home, we are all too familiar with what a pandemic is. This microvideo resource has been designed to support you to consider pandemic planning so that you will be best equipped as the situation unfolds. Brisbane North PHN acknowledges the Aboriginal and Torres Strait Islanders as the first people of Australia, and we pay our respects to the traditional custodians on whose land we walk, we work, and we live. The content featured in this microvideo resource was created by David Osman. David is a healthcare practice manager and practice owner education facilitator. He has an advanced diploma in management and is a member of the Australian Institute of Company Directors. He is a certified practice manager and a member of the Australian Association of Practice Managers, or AAPM. He has served on the AAPM Victorian Committee for the past 8 years, taking on a role as state president and secretary during this time. First of all, for pandemic planning, you should consider the key things that are related to how your pandemic plan works in your practice. Consider what is your pandemic plan for your practice. Next, where do you keep this pandemic plan and who has access to it? How do they access it? If it's electronic, can people access it from outside of the practice? And who are the people who are responsible for managing the security and permissions to access that plan? You also need to consider who has the responsibility for the implementation of the plan. It doesn't need to be a single person, but to ensure your practice is capable of mitigating the risk of a pandemic, you need to ask this question. Having one person take on the responsibility that there is a plan and that it can be implemented will provide your whole team with the security of there being a plan to action. Is the plan current? Has it been updated to reference COVID-19, for example? Now, prompted as we are by a worldwide epidemic, it's a good opportunity for you to consider issues that may have come up during the pandemic and how they may influence your plan. Finally, once you have your pandemic plan in place, do you have a pandemic plan process that links with disaster recovery? And how do you use that in your practice? If we reflect on what pandemics are and what they mean for the community, they are generally considered a widespread occurrence of an infectious disease occurring across our community. Pandemics occur on a scale that crosses international boundaries, usually affecting people on a worldwide scale. For example, the Spanish flu, the Black Death, also known as the plague, and COVID-19. The COVID-19 pandemic is an example of a pandemic which has changed the way medical practices operate. From a contingency perspective, we now have to consider the alternative delivery of healthcare, including online or telehealth consultations. Many practices had to pivot to telehealth and the use of online technology. Infection prevention is another important area to consider, along with the impacts on staff and patients. Also, access to information, privacy, and health records. We need to consider the widespread relationship between privacy and health records, and how that impacts on the running of your practice. And of course, we shouldn't forget about the fact that we are running a business when it comes to medical practices, so we need to maintain our financial stability. These are all some of the key things you need to consider when you are recovering from a pandemic. So, what should be included in your practice's plan? This list is not exhaustive, but the following key things should be included in your pandemic plan. First of all, how do you identify public health advice? What are the mechanisms you use from websites to Twitter to email alerts? Do you have contact information within your pandemic plan that covers the relevant organizations and stakeholders that you need to involve? Has there been a risk assessment involved in this process? This is a really good opportunity for your practice to consider all of the various risks that a pandemic may bring, both internal and external. It should also cover off precautions, and this links in very well with infection prevention. Certainly, we've learned a lot through COVID-19 and have updated the precautions we take accordingly. As the conditions change, so should the precautions in your pandemic plan. Also, as mentioned before, what are the links to your disaster recovery process? Because when you recover from a pandemic, you need to have clear processes in place about how those things will be linked. Finally, education is really important and a key part of any plan that you have in place in your practice. This includes checklists of policies and procedures, or any other things that you need staff to be aware of. If we think about the way we need to respond to a pandemic, the following 3 items are certainly important to having a coordinated response. When you become aware of the impacts of things that may be coming, you need to consider them from a staff perspective. You also need to consider them from a patient perspective. And, of course, you also need to consider the coordinated response from health authorities. Firstly, it involves a process of identifying what it is that you're responding to. Once you identify and articulate that, you move through the phases of looking at how you respond. What are the things that you need to put in place in your practice when a pandemic occurs? And of course, very importantly, the recovery phase, and this could go on for quite some time, days, weeks, months, or even years. Take COVID-19, for example, which is really relevant to us currently, and something that we will be recovering from for quite some time to come. So, thinking about all of those processes that we go through, we should look at them very much from the perspective of all of the relevant stakeholders involved in the process. Patients are the core and the key to our practice, and we need to consider them both from the current state of things, but also how the changing service delivery within our practice is going to impact the way that people may interact with us, or choose our practice as a first point of care for them into the future. We also need to consider staff and, within that group, we're talking about both health professionals and the support staff that are involved. In a pandemic, the front line of your practice is generally the reception team, your admin team, and your nursing team. They're the ones that are going to experience the most interaction with patients. Take COVID-19 again as an example. They've been critical in the process of being able to raise your awareness of patient conditions, symptoms, health alerts, and all of the things that you need to be able to do to ensure you're protecting your practice team and other patients. And of course, health authorities are really important in this process, both at the state and federal level, as well as the relevant public health units that may be involved. So, if we consider how practices protect our staff and our patients, there are a few things that are really key to this process. First of all, following all the relevant health advice and keeping up to date. There are obviously a range of different ways that you may have access to information, but certainly be aware of the health authorities' advice on all of these issues. When you need to respond to the health authorities' advice, have information promptly available for patients and staff. You need to be able to respond swiftly and to be overly cautious, because when you're faced with something new, something that you're not certain about where it's headed, you need to be able to ensure both your staff and patients are well protected. And health awareness is really important here, ensuring that you have posters up, information available to patients and that it's accessible. Also, support for patients from different cultural backgrounds and different age groups, making sure that information is readily accessible to them as well. And crucially, ensuring things like hand hygiene and social distancing requirements are clearly communicated to patients, as well as explaining the risks of using services. There's lots of different methods you can use in terms of communicating information, such as waiting rooms, websites, messages on hold. And with all the various avenues that may be available to you, make sure you use them as effectively as possible. The key message here is that you need to think about what your plan to operate during a pandemic is, both from a practice perspective, but also from a business and patient continuity perspective as well. So, during a pandemic, consider what are the things that you can do, and what are the things that you can't do. And are there alternatives, different mediums, or different solutions to those things? The key for your business and patients is to be able to continue to provide healthcare services during a pandemic. Here are some questions you may need to ask yourself from a practice business as usual perspective, considering what the health advice allows from a face-to-face patient perspective. Can patients come into your practice, or are there restrictions in place that would prevent this from occurring? or simply not make it safe for both practitioners and patients. Can you pivot services to telehealth? This is something through COVID-19 that's been a really relevant and important tool. Can you use telehealth for future pandemics or other activities where you can't necessarily provide face to face services? And, depending on what the health risk is there an ability for you to relocate services? If the impact is specific to a location, can you move delivery of those services to another location? Underlying all these things, what is really important to consider is that if you defer patient care, there may be a greater long term impact on patients and, of course, for your practice as well. A key process in a pandemic and following health advice is the identification and reporting requirements. It's really important for health authorities to have information about your patients and their contacts. And so, also having these details recorded for your personnel and other people involved in the service delivery is critical. Some of the resources that you might consider using include contact tracing databases, whether it's a manual register through a software application, or even QR codes, something that's become part of everyday life through COVID-19. Where do you get up to date health advice? It's important to access information from a trusted and reliable source. Provided on the screen are a few website examples. These sites may also provide links to email subscription lists that alert you to updates. Don't forget to also save trusted websites as a favorite in your web browser. It's difficult to judge the impact of pandemics on staff and patients. Patients have had a lot of strain on them during the COVID-19 pandemic. It has an impact on anxiety and encounters. So, we need to consider what are the things that protect patients, as well as your staff who are going to be impacted. Your staff are the ones who are going to be interacting with the patients, and they could be under a lot of strain. So, we need to consider some of the things we can do to protect our team and to protect our patients. Regular communication is absolutely key to all of these processes. Having information available in your waiting room, on your website, phone messages, text messages, anywhere you can provide information to your patients will be useful. Using social media is really important because if you're changing the way you're delivering things, make sure that information is readily available. If someone is traveling to your practice to find the doors are shut and they can't come in, and they aren't aware of that, that's going to increase the level of anxiety. It's also important to ensure information is provided in a way that people can understand. So, consider translation for people with different cultural backgrounds, and also consider the linguistic diversity that is required. You should provide opportunities to provide feedback during a pandemic. Make that information live, active, and something that you look at on a regular basis, because that key information could change the way you deliver services. That information could impact on something that you weren't aware of that could be a simple change for the service delivery of the practice. And that change could have a massive impact on everyone in the team, patients and staff included. For staff, you really should have an important process in place to support them to reflect on any changes in their daily work and the impact of everything they do. Things like having regular team catch ups, having a communication board, and having a process where people can tell you about the things they come across that may be able to be relayed back to the practice team and that may impact on the way you do things in your practice. And, of course, keeping staff abreast of GP changes, especially with health advice. As you know, announcements will be made about health advice very quickly, so keeping on top of things and getting that information out to staff is really key. We're not going to get away from the fact that sometimes information is being made available to the public and we need to respond at the same time in our practice. But being on top of that as quickly as you possibly can and giving the team the opportunity to jump on those changes and be aware of them is really important. So, communication to your team is really crucial. The other important component that we need to really be aware of is around team self-care. You need to draw on the strengths and the diversity within your team. You need to be able to anticipate processes from major disruption to people and understand the impacts on them emotionally and physically. People come from a range of different backgrounds, and so they can be resilient, but understanding the needs of individuals over a period of time is really important. Your practice should consider self-care and use the tools that are available. whether it's from professional services that you may be able to support your team with, whether it's through information available, or just check in with the team throughout that process. COVID-19, as an example of this impact on our practices, has been a long, drawn-out process, and so that obviously has a major impact on staff physically and emotionally. Practices should consider staff self-care. Support your staff with resources, tools, and, where necessary, professional services. For further information on pandemic planning, you can visit these links or view some of our other microvideo topics. Thank you for taking the time to learn more about the importance of pandemic planning in primary care. This is the end of the presentation.
This microvideo is supported by funding from Brisbane North PHN through the Australian Government's PHN program.